Going into the weekend, there were 298 active COVID-19 cases, and that number is expected to increase as at least one variant of the virus has been detected in the country. With an increase in transmissibility, in the Belize district alone, the numbers have almost tripled.
In Central Region, over the last week and a half, we have been seeing an increase in cases compared to over the last few months. In fact, I think that in the last 2 to 3 weeks, we've gone from 52 active cases, and to date, we have 135 active cases in the Belize district. So the number has definitely increased significantly. And of course, that's a concern for us here at the Ministry of Health. A lot of the cases, definitely there are close contacts that have come back positive. We do know, and we've noticed a trend for a few weeks ever since the minister had announced that we do have variants of concern. And we do believe that definitely with the variants, we would see an increase in cases because with the variants, they are more transmissible by over 60% of the normal COVID strain.
Deputy Regional Health Manager Dr. Melissa Diaz-Musa explains the reality on the ground as public health officers conduct contact tracing.
Over the recent weeks, we've noticed that entire households or even at workplaces, sometimes you'll have 1 or 2 staff members who have come back positive. Now we're seeing if you have 15 staff members, 10 may be positive. So definitely one of the variants of concern is probably attributing to the increase of cases we're seeing in the Belize district.
Starting today, the KHMH will be in emergency mode as they ramp up their response to the rise in COVID-19 cases. During this time, elective surgeries will be on hold until further notice. There will be no outpatient clinics, and visitors' policy has been readjusted to restrict the number of persons in the facility. The National Referral Hospital has once again been transformed to guarantee the best patient care and outcomes in response to the COVID-19 pandemic.
We work very closely with the KHMH. Of course, the difference with Central Health Region is that KHMH is both our secondary and tertiary referral hospital, whereas other regions have their secondary hospital in the district. So on a daily basis, at least 3 to 4 times a day, I'm in communication with their epidemiologists, with A&E staff. We continuously try to exchange information. We do contact tracing together as well. So we definitely have a very close and good working relationship with KHMH. Quite a few of the cases are from the Belize district. It's important to note as well that the cases that are more unwell are cases that of unvaccinated persons.
While there has been an uptake in vaccinations across the country, Belize is in its 3rd wave. There have been a number of deaths recorded over the last week, and Dr. Diaz-Musa says that the vaccine saves lives.
At this point, access is not a problem. For the Belize district, we have 2 or 3 main sites, or we have 2 sites, especially Swift Hall and Central Health Region, that we are here vaccinating every single day. We've started to open Central Health Region site on a Saturday morning as well. So if you can't make it during the week, please take the opportunity and come out and get your vaccine Saturday morning. And we're also doing numerous outreach. We're going to the River Valley, we're going to businesses, we're going to areas, for instance, by the Civic Center, we're there this morning. So we're trying to ensure that access is not a problem, that wherever you live or however you commute, you're able to find one of our sites and get your vaccine done.
Duane, Moody for News 5.